10 years ago, in a melanoma clinic at any academic center or in any busy private practice, you would never use the word cure with your patients. You could try to prolong survival, improve quality of life. It was regarded as palliative care to use almost anything. In those select centers that used high-dose IL-2 a decade or more ago, as I did in the past, about 3-4%, maybe 5% of the patients would be long-term survivors at 10 years. Those would be the CRs to high-dose IL-2. But even not all of the CRs to high-dose IL-2 would be alive at 5 or 10 years. So it was a very small number. The vast majority of patients, cure was not in the cards. Today, it has to be part of the discussion when you first see a new consult. And that's great. It means a lot of work for you. You have to prepare the management plan, the so-called survivorship plan, but it gives great hope to patients. It's great for morale of everyone. The staff really appreciate the difference in the busy centers like the ones I've worked in the past. Again, 10 years ago, survival wasn't an expectation. Now it's an expectation. As an example, I recently went to a patient symposium in Los Angeles, and I left LA about 10 years ago. I was at the University of Southern California, the Norris Cancer Center, and 6 patients of mine who had received ipilimumab, alone or in combination, greeted me at the symposium. They came because they heard I was going to be there, and they looked great. So remember, 10 years, metastatic disease, those patients are probably cured. So it was quite an experience to see patients 10 years out who had metastatic disease treated with ipilimumab. So yes, I think you can cure people.